If you're over 60, I want you to take a slow, deep breath. Now think about this. Every single day, millions of seniors take medications they trust. They take them for sleep, for pain, for allergies, for anxiety, for the bladder, and for heartburn. But what most older adults don't realize is that some of these medications, yes, the common ones, may quietly affect your memory. Not dramatically, not suddenly, but slowly, silently. One forgetful moment at a time. Maybe you've misplaced your glasses more often. Maybe you've walked into a room and forgotten why. Maybe you've felt foggy, tired, or not quite yourself. And maybe, just maybe, it wasn't just aging. It might be related to the medications you're taking. Today, we're going to explore 9 of the most commonly used medications that may increase dementia risk in older adults. This isn't about fear. This is about understanding, staying informed, and giving yourself the chance to protect your memory, your independence, and your brain health. You deserve clarity, you deserve answers, and you deserve to know the truth. As we grow older, our bodies change in ways we don't always feel, but that deeply affect how medications work. The kidneys work slower, the liver processes drugs less efficiently, and the brain becomes more sensitive to medications that affect memory and focus. This means that a pill you took easily in your 40s or 50s can have stronger and longer-lasting effects in your 60s, 70s, and 80s. One of the most important chemicals for seniors is acetylcholine, the neurotransmitter responsible for memory, learning, and attention. Some medications block this chemical, and when acetylcholine levels drop, the brain struggles to communicate clearly. This can lead to brain fog, forgetfulness, slow thinking, or confusion. And guess what? Many seniors believe these symptoms are normal aging, but very often it's medication-related cognitive decline. Understanding this connection is one of the most powerful steps you can take for lifelong brain health. Let's begin with one of the biggest hidden causes of memory issues in older adults: sleep aids, especially PM formulas. These include medications containing diphenhydramine, a strong anticholinergic drug that blocks acetylcholine. These pills are meant to help you sleep, but in seniors they may also cause next-day grogginess, confusion, memory lapses, difficulty concentrating, increased dementia risk with long-term use. If you're using nighttime pain relievers or PM sleep aids several times a week, it's time to review them with your doctor. There are safer alternatives, melatonin, magnesium, and lifestyle adjustments that support sleep without harming brain health. Anticholinergic drugs are some of the most commonly used medications among seniors, and also some of the most concerning when it comes to memory and dementia risk. These medications are used for allergies, sleep problems, anxiety, overactive bladder, and even stomach issues. But here's the hidden truth. Anticholinergics block acetylcholine, one of the brain's most important chemicals for memory and learning. When acetylcholine levels drop, your brain struggles to store new information, focus, or process thoughts clearly. Many adults over 60 take these medications daily without understanding that long-term use has been linked to faster cognitive decline and increased dementia risk. Common anticholinergic drugs include diphenhydramine, certain sleep aids, older antidepressants, and some bladder medications. And while these drugs can help with symptoms, the impact on brain health can be significant, especially for older adults whose brain chemistry is already more sensitive. If you often feel foggy, forgetful, or easily confused, and you take one of these medications, your brain may be telling you something important. Talk with your doctor about safer alternatives. Your long-term memory and cognitive health are worth protecting. Benzodiazepines, often prescribed for anxiety, panic disorders, and insomnia, can be helpful in the short term. But for seniors, especially those over 60, these medications can have powerful effects on the brain. Drugs like lorazepam, diazepam, and alprazolam slow down brain activity, which may provide quick relief, but also interfere with memory formation and clarity of thought. Long-term use has been linked to an increased dementia risk, slower reaction time, poorer concentration, and nighttime confusion. Many older adults develop dependence without realizing it because benzodiazepines calm the nervous system so effectively that stopping them suddenly can cause withdrawal symptoms. If you or someone you love uses benzos daily, this isn't about blame, it's about awareness. Seniors deserve treatment options that protect both emotional well-being and long-term brain health. Discuss safer sleep or anxiety alternatives with your doctor. Protecting your cognitive future begins with understanding your medications today. Sleep medications, especially sedative hypnotics, are widely used among seniors, but they may not be as harmless as they seem. Drugs like zolpidem, esopiclone, and zaleplon slow brain activity to help you fall asleep, but this same effect can harm memory and reduce cognitive sharpness over time. Many seniors report feeling groggy, forgetful, or unsteady the next morning. For older adults, even small disruptions in sleep architecture, like reduced REM sleep, can impact brain health and increase dementia risk. And when used long-term, these medications may contribute to brain aging at a faster rate. Improving sleep naturally through evening routines, light exposure, gentle exercise, and calming techniques can protect memory far better than relying on sedative medications. Talk with your healthcare provider about safer strategies that support both sleep and long-term brain wellness. Not all antidepressants raise dementia risk. However, older classes like tricyclic antidepressants, amitriptyline or nortriptyline, can have strong anticholinergic effects which interfere with memory and cognitive processing. For seniors, these effects can be even more noticeable due to age-related changes in brain chemistry. If you take an antidepressant that was first prescribed many years ago, it may be time to talk with your doctor about newer options. Today, many safer antidepressants provide emotional support without compromising memory or cognitive health. Depression in older adults is real, serious, and deserves proper treatment. But treatment should protect the mind, not burden it. Awareness gives you the power to choose what's best for your long-term well-being. Antipsychotic medications like quetiapine, risperidone, and olanzapine are sometimes prescribed to older adults for mood symptoms, agitation, or sleep, but these drugs carry strong warnings. For seniors, especially those with early memory problems, antipsychotics can worsen cognitive decline and increase the risk of dementia progression. These medications reduce brain activity in ways that may calm symptoms, but also diminish awareness, alertness, and memory. They should only be used when absolutely necessary and always under close medical supervision. Never stop antipsychotic medications abruptly, but do have open conversations with your healthcare provider about safer alternatives or lower doses. Your brain deserves thoughtful, careful treatment. Medications like oxybutynin or tolterodine are commonly prescribed for urinary urgency, but many of these drugs fall into the anticholinergic category, meaning they may impair memory and increase dementia risk. For seniors, the effects can be subtle at first, more forgetfulness, difficulty concentrating, or feeling mentally slower. Over months or years, the cognitive cost becomes more noticeable. Ask your doctor about newer bladder medications with fewer effects on the brain. Sometimes small changes can lead to much healthier aging. Older antihistamines like diphenhydramine can make seniors feel drowsy, but they also have strong anticholinergic properties linked to higher dementia risk. Many over-the-counter nighttime cold or allergy medicines include these ingredients. If you rely on these medications for allergies or sleep, ask about non-sedating alternatives that do not affect memory or cognitive clarity. Pain medications, especially opioids, can slow down brain processing, impair memory, and increase confusion in older adults. Drugs like hydrocodone, oxycodone, or codeine, even when taken as directed, can affect cognitive function. Chronic pain matters, but so does your long-term brain health. Many seniors don't know that extended opioid use may increase dementia risk and reduce mental sharpness. Working with a doctor to reduce reliance on opioids, explore non-drug therapies, or switch to safer alternatives can significantly support brain health. Proton pump inhibitors like omeprazole are often used for acid reflux, sometimes for far longer than medically necessary. Research suggests that long-term, high-dose PPI use may be linked to higher dementia risk, possibly because of nutrient absorption issues, gut-brain axis disruption, and inflammation. If you've been using PPIs for months or even years, it may be time to discuss step-down therapy or alternative treatments with your doctor. So now you know the 9 medications most commonly linked to increased dementia risk in people over 60. Remember, this video is not telling you to stop any medication on your own. Your doctor knows your health history, and any changes must be done safely and gradually. But knowledge is power. And by understanding how medications affect your brain, you can begin making informed decisions that protect your memory, your independence, and your long-term cognitive health. Now that you understand which medications may increase dementia risk, the next step is knowing how to protect your brain starting today. And the truth is, it doesn't require big, overwhelming changes. Sometimes the most powerful improvements come from simple decisions made consistently. Begin by reviewing your current medications. Write them down. Include the dose, how often you take them, and how each one makes you feel. Bring this list to your next doctor's appointment and ask, is there a safer alternative for my age? Is this still necessary? Are there options that protect my brain health? Next, focus on supporting your cognitive wellness through daily habits, gentle movement, quality sleep, hydration, nourishing foods, sunlight in the morning, and social connection. These habits strengthen your brain in ways that no pill can. They support memory, stabilize mood, and help protect against cognitive decline. You are not powerless. You are not too old to make changes. Every small step toward understanding your medications and caring for your brain is a step toward staying sharp, confident, and independent for many years to come. Your brain deserves care, and you deserve the healthiest possible future. If you are over 60, your health journey is still unfolding, and your brain has an incredible ability to strengthen, adapt, and heal. Avoiding medications that may increase dementia risk is not about fear. It's about empowerment. It's about protecting your memories, your independence, your identity, and the life you love. You've taken an important step today simply by watching this video. Most people never learn this information, but you did, and that means you're already ahead. Remember, you deserve clear thinking, steady memory, and a healthy, active mind for many years to come. If you found this video helpful, please consider subscribing. This channel is dedicated to senior health tips, brain health, healthy aging, and evidence-based guidance to help you stay strong, confident, and independent. Your support allows us to continue creating content that helps millions of older adults. Take care of your brain, take care of your body, and as always, thank you for spending your time with us today. Stay healthy, stay informed, and stay hopeful.